Hi, Mr. Phillip.
Hello?
My name's Patrick. I'm your nurse today. Today we're going to be doing a physical assessment. Is that okay with you?
Yep.
Alright, before we get started, I'm going to wash my hands. I'm going to make sure I have the curtain pulled just to give us a little privacy. Alright, you ready to get started?
Yep.
Alright, first I'm going to start off by looking at your skin. I can see your hand. There's no cyanosis of your hands. Looks like your hair is evenly distributed. Capillary refill time is under 1 second. Let me see the other hand here if I can. You haven't noticed any redness, swelling, any pain in your arms or legs? How about your fingers or toes?
No.
Nothing like that? Anywhere else on your body? You have any lesions or anything?
No.
No? No skin issues? Alright. Do you get any cramping in your legs when you walk at all or anything like that?
No, not usually.
No? Okay. Your skin felt a little warm. I'm guessing that's maybe because you look a little bit sunburnt. You're out in the
Yeah.
sun this weekend?
Mm-hmm.
Yep. Alright. Next I'm going to get started on I'm going to feel your skull. I'm just feeling for symmetry on both sides. I'm going to feel your lymph nodes in the back. They're not painful or tender at all?
No.
No? Alright. Feel your lymph nodes here. Okay. Just going to feel your trachea. Make sure it's all midline. Alright. Next thing, I'm going to feel your sinuses. You should feel a little bit of pressure, but it shouldn't hurt. You feel a little bit of pressure?
Mm-hmm.
A little bit of pressure there too?
Mm-hmm.
Have you had any sinus problems? Any pain or swelling?
No, not too much.
No, nothing like that? How about your eyes? Have you noticed any drainage?
Nope.
No? Okay. Now, normally I would use a pen light, but since I decided to stop working a couple days ago, I'm going to have to use my phone. If you can just look at the mirror behind me, just stare straight ahead. Okay. Pupils are equal, round, and reactive to light. Okay. Next I'm going to have you, if you could follow my finger with your eyes. Let's try that one more time. Alright. Next I'm going to look inside your nose. Normally I would do that with an otoscope. It's an attachment, but since I don't have one, I'll make do with what we got. Have you had any drainage or anything? You get any seasonal allergies?
No, not too much.
No? Okay. I don't notice any inflammation or anything. Alright, can you open your mouth for me? Alright. Any problems inside your mouth?
Nope.
Any lesions, any sore spots or anything like that?
Nope.
Okay, I'm going to just take a quick look at your teeth. Do you brush your teeth regularly?
Mm-hmm.
Visit the dentist every year or so?
Mm-hmm.
Okay. Now if I can have you stick your tongue out and say ah. Okay, your oral mucosa is pink and moist. Soft palate rises when you stick your tongue out and say ah. Okay. Next, I'm going to stand behind you and I'm just going to check your hearing for me. So, what I'm going to do is I'm going to close off this ear and I'm going to whisper 3 random numbers or letters, okay? And if you can, repeat them back to me. A, C, 5.
AC5.
Yep. C, 4, W.
C4W.
Yep. Alright, next I'm going to have to ask you to take your shirt off for me so I can assess your chest. Sorry, it's a little bit chilly in here. Okay. I'm just going to count your rate and rhythm of breathing real quick. Alright, 18. Okay, you can take a couple deep breaths for me. I'm just making sure that your chest expansion is the same on both sides. Okay. Actually, if you could turn around on the stool for me real quick. I'm going to do the same thing with your back. Okay. I'm just going to listen to your lung sounds real quick here. Can I have you take a few deep breaths for me? Alright, now if you could turn around on the stool, do the same thing for your back. Okay. And one more thing, if you could turn back around for me. And I'm just going to feel for any fructose. Alright, so what I'm going to have you do now is lay down on this bed for me. I'm going to listen to some of your heart sounds. Alright, now if you can put your left arm above your head and kind of roll over towards me. Okay. Ideally, we'd be doing this on a harder bed, but again, kind of working with what I have. Alright, no murmurs, no adventitious breath sounds so far, or heart sounds. If you can sit up for me. Just gonna listen to your heart one more time here. Okay. I'm just feeling for your apical pulse here. There it is. Alright, we can move back to the stool now if it's a little more comfortable for you. Alright, now I'm just going to feel for your carotid pulse. Okay, now if you can put both of your arms like that, there you go. Feel for your radial pulse. Make sure I'm getting the same thing on both sides. Alright, now I'm going to go down a few pulses in your feet. Dorsalis pedis. And your posterior tibial. Is always a hard one to find for some reason. Alright, and last but not least, I'm just going to feel for the pulse in your wrist while I listen to your heart rate. Just to make sure there's no pulse deficit. Okay, next I'm going to be assessing your abdomen. So if I can have you lay down here on this bed. So what I'm looking for is just everything that is symmetrical, no abnormal lumps or masses. If you had any pain or anything, you noticed any abnormal swelling, any pain on one side or the other?
Nope.
No? Nothing abnormal to report at all?
Nope.
Okay. So what I'm doing here is I'm just looking. The light kind of helps show some shadows. It helps me visualize if there's anything asymmetric. Okay. And I'm just verifying that I can visualize your abdominal pulse. Yep. Alright, so next I'm going to listen to your bowel sounds. Those are just some noises that your body makes when you're digesting. Did you just eat a snack not too long ago?
Yeah.
Yep. They're a little bit hyperactive, but that's normal after you eat. Next thing on the list, I'm just going to be palpating your abdomen. I'm going to feel for anything that feels abnormal, or if there's anything tender or that hurts, you let me know, okay? So first I'm just going to feel lightly, and then I'm going to go around a second time and feel a little bit deeper. I'm sorry. Next I'm going to percuss your abdomen. Now I'm going to palpate your abdomen. No tenderness at all? Alright, I'm not feeling any abnormal masses or anything. Now I'm going to go a little bit deeper. Let me know if it hurts or if it's tender. Alright, you can go ahead and sit up for me. Next I'm going to do a neurological check. So it should be hopefully some pretty easy questions here. Can you tell me your name?
Philip Weisbrod.
Can you tell me your date of birth?
March 25th.
Do you know where we are?
In the bedroom.
Do you know what we're doing right now?
Having a physical exam.
Yep, and can you tell me who our president is?
Obama.
Alright. Next, if you want to sit back on that stool for me. I'm just going to do a couple reflex checks for you. So what we're going to do here first is check your patellar reflex. So I'm just going to tap your knee lightly. And hopefully we'll see a reflex. Make sure you relax your knee a little bit for me. It's a pretty strong reflex. Make sure you relax your knee for me a little bit. Alright. Now if you can put your foot up on this bed maybe a little for me. I'm going to check for your plantar reflex. I want your toes to curl in, kind of like that. Alright, can you put the other foot up there for me? Do you normally wash your feet, or were you just running around outside?
Running around outside.
Alright. So next thing I'm going to do is I'm going to have you close your eyes and have you tell me if this is a sharp or a dull object.
Sharp.
How about that?
A little more dull.
Yeah, not very dull, but
Yeah.
okay, same thing here. Close your eyes.
Sharp. Dull.
Alright, I'm going to go for your palms.
Sharp. Dull.
Other palm.
Sharp. Dull.
Okay. Next, I'm going to draw a number on your palm and have you try to guess what it is.
A 0.
Let me try one more time.
A 0 or a 6.
6.
Okay.
It's a little difficult one, I guess. Let's try this. Keep your eyes closed for me.
7.
Yep. Okay. Now what I'm going to have you do is close your eyes, and I'm going to put an object in your hand and see if you can tell me what it is. Just feel it.
A key.
Yep. And if I can see your hands, what I'm going to do, you can open your eyes. What I'm going to do is I'm going to move one of your fingers up or down, and you tell me which way I'm moving them.
I can look.
No, I'm going to have you close your eyes.
Okay.
Alright, keep your eyes closed.
Down. Up.
Alright, we'll try this again with the other hand.
Down. Up. Up. Down.
Okay. Like I said, hopefully they should be some pretty easy questions for you. Okay. Now what I'm going to have you do is I'm going to put some pressure on the side of your face and have you try to turn your head. Can you turn your head towards my hand? Yep. Now I'm going to push down your shoulders and have you try to move them. I lift them all the way up, slow and steady. Yeah, like that. All right. And then I'm going to feel your jaw here and have you clench your teeth. Okay. One more time. I'm just looking to make sure your muscles are symmetrical. And now keep your jaw clenched, and I'm going to try to push down on your chin. Okay. And now, I'm going to try to keep your eyes closed and you try to open them. Yep. Alright, now next thing we're going to do is if I can have you hold your arm out in front of you, like this. Touch it to your nose, touch your finger to your nose. And put it back out. Now with the other arm, touch your finger to your nose and back out. Now if you can put your arms out to the sides like this and bring your fingers together. One more time. Alright. Now if I can have you lay down on the bed real quick. Okay, so you're going to keep your right leg straight and move the heel of your left leg from your ankle all the way up to your knee and back down. Slow and steady if you can. Alright, now do the same thing with the other leg. Okay, next thing I'm going to have you do is stand up for me. Now if you can stand and face me, maybe stand out in the middle here and face me. Keep your feet together, stand straight and tall, and you can close your eyes and stand still for 10 to 20 seconds. Okay, now if you can come over here for me, I'm going to have you stand here and I'm going to take a look at your gait, the way you walk. So I'm going to have you walk slowly about 10 feet to the other side of the room and then stop and turn around and walk slowly back to me. Okay. Alright, if you can sit back on the stool for me. What I'm going to do now is just do some range of motion stuff. Make sure that your joints are all moving properly and nice and strong. So can you move your head from side to side? Try to go maybe just a little more slow and even. Tilt from side to side. And I'm going to try to prevent you, so just do the same thing. Okay. Now if you can go lean your head back and forward. Okay. Same thing, forward. And back. Alright. Can you turn your head as far as you can in either direction? Alright, now with your shoulders, what I'm going to have you do is lift your shoulders all the way up, all the way back down. Stand up for me. I'm going to have you take your arms and lift them up like this, and back down. And one more time, and I'm going to push against them. And back down. Okay. Now can you go all the way up above your head? All the way back down, out in front of you, and back as far as you can go, and then there you go. Alright, now I'm going to take a look at your elbows. So if you can, I guess you can sit down for this part if you want. Flex your elbows. Try to do it without moving your arm as much. Flex your elbow, up, down. Alright, up, down, okay, up with both of them, down, okay. Now I'm going to your wrists, so if you can flex your wrists, extend your wrists, rotate them in a circle, okay. Turn your hands over like this. And I'm going to have you lift your palms up, down, okay, same thing, up, down, okay, push your arms down on mine like that, down, and try lifting them up, okay, same thing with your fingers, down, and extend your fingers. Can I have you do this with both hands? Flex your fingers, extend your fingers. Alright, now stand up for me. I'm going to have you bend forward at the waist like that. And kind of lean back for me like that. Can I have you lay down one more time? Okay. I'm going to have you lift your leg. Your left leg straight up in the air for me. Alright, now your right leg. Okay, back down. If I can have you bend your knee and bring it all the way up. Back down. Other knee all the way up. And back down.
It's about to come out.
Okay, and your feet up. Down. Feet up. And back down. And can I have you?
It's about.
Is that it?